Welcome to the Norfolk CSB CIT Center.
The Norfolk Community Services Board Crisis Intervention Center and Crisis Intervention Team program began in October 2014. The program provides Norfolk Police with advanced training and skills to deal with mental health crisis in the field.
Known results from this program includes reductions in incarceration, prevention of officer and client injury, and improvement in access to effective treatment and services.
The 24/7 CIT Assessment Center at the Community Services Board is where police can bring persons in crisis to receive emergency services evaluation, access to treatment, and engagement with peer support staff.
So the CIT Assessment Center is designed to be a warm and welcoming place. Intentionally does not look clinical, gives us the opportunity for people to relax, be able to return to a less stressful state while we're working on opportunities for assessing the type of treatment they may need or resources. Sometimes people come in, they're not very comfortable, they may have been out in the rain, so we have the opportunity to give them sweats, hygiene kits, socks. The more we can do to help them increase their personal comfort, the better we can assess what their baseline is for what the actual mental health crisis component is.
There's even a place for brief medical assessments.
We can check for things like blood alcohol level, intoxication from substances. We can check their blood pressure to make sure they don't have anything else going on that we need to pay attention to during the assessment. So when we establish the next stage of treatment, we've made sure that we've established that baseline for their health and safety as well. This has helped tremendously, because historically, almost everyone had to be run through the ER to get this mental health assessment, and we're able to significantly reduce the utilization of the emergency room, the amount of time people are waiting to get to that mental health assessment, and for the police officers' time as they escort them through the whole process.
And a 24/7 mental health emergency services team and call center, which takes in an average of 3,000 calls each month.
Of those calls, we provide about 300 face-to-face interventions, and we are very mobile. So we, of course, work with the police department and we assess folks in their homes, but we also may go to schools and the jail and other places wherever a person's having a crisis, and of course invite people to come to our crisis assessment center.
The CIT program also includes training Norfolk police officers to better interact with those in mental crisis.
Our police department, in conjunction with CSB, was able to train over 200 officers in less than 6 months.
And recently, all that work was recognized.
Today, the Chief and I are proud to announce that the Norfolk CIT program, being less than a year old, was awarded the 2015 CIT Program of the Year by the Virginia CIT Coalition.
One of the things that has come out of this has been our CIT roving patrol, which is something that's not being done everywhere. We now have officers on the street that are dedicated to answering our calls for service that involve the mentally ill. This has been a tremendous benefit to our police department. We have been able to reduce the number of officers that are tied up on these calls because they are complicated calls and complex calls that require a lot of resources. And our officers that have volunteered for this duty have been very dedicated to it and have done an excellent job.
An excellent job by everyone involved, including the Norfolk Police Department and Norfolk Community Services Board, going from not having a crisis intervention program to having the top program in the state in less than a year, showing once again why Norfolk is a resilient city.